Welcome to the Reconcile podcast, where we're confronting cultural lies with hope, discernment, and biblical truth. Today, we have a special guest with us, Dr. William Lile, known as the ProLife Doc. Thank you so much for being here with us today, William.
Well, it's an honor to be on with you, Kaitlin, today, and thank you for the opportunity to share some new tools and some new information that we can use to defend God's preborn in the womb.
Yes, absolutely. So let's just start there. Let's start with a little bit more about who you are and what you do.
Well, my name is Dr. Bill Lile. I practice obstetrics and gynecology. I'm board certified. I've delivered over 5,000 babies, licensed in multiple states. I've been in private practice since 1999. In 1999, the practice that we actually took over was the largest abortion clinic here in Pensacola, Florida. We took over the practice. We had him sign a 2-year non-compete, and on day one, we stopped all and abortion referrals. And it wasn't until a Sunday afternoon, right before we were to open up, that I actually got the opportunity to go upstairs at the clinic, which is where the abortion machine and the clinic was. And I couldn't believe that tens of thousands of women right here in conservative Pensacola, just down the street from Pensacola Christian College, had gone into that office, walked up those stairs with a kicking viable baby on the inside, and then spent a half hour up there and walked down those same stairs without a baby. So we did a presentation at my church, which led to another church, and now we'll be on the road speaking at least 50 times each year, trying to show that these are my patients, both the moms and the babies, and that this is a spiritual battle, and we need to encourage our pastors, priests, and rabbis to engage with their spiritual tools.
Yeah. So what inspired you to get started in this? I mean, were you always pro-life as a medical professional, or was there a point that changed your mind, or just what inspired you to start this ministry and start speaking in this way?
Well, I was always pro-life, even as a kid. My parents, we grew up in New Jersey, and we would always go to the Pregnancy Resource Center annual banquet up there in Cherry Hill, New Jersey. So I recognized the fact of this is a person, this is a patient on the inside. And when I went to medical school, I really wasn't thinking about doing obstetrics and gynecology. I was really thinking about trauma surgery or ER. That seemed to be where I had my interest. But it was when I did a rotation in obstetrics that the world just opened up. It's like, this is the only time when people are happy to go to the hospital. And you get to see patients from their teenage years when they're making some, big changes in their lives. And then you get to be with them when they're going through pregnancy, delivering their babies, but you also get to do a lot of surgery and care after they've gone through menopause. So for me, it had everything. And the real key was we were just starting to not only diagnose babies in the womb back then, but we were just at the inception of actually treating them in the womb. We were doing blood transfusions at our hospital way back in 1999 with our high-risk maternal fetal medicine specialist. So clearly, whenever we had a pregnant patient, we had 2 patients. And if she had twins, we had 3 patients. And I've delivered triplets and quads. And when you have quads, you've actually got 5 patients that you're caring for and concerned about the health of all of those patients. And so as I started to learn more and develop my practice, and our practice grew, we had 3 maternal fetal medicine specialists in our practice, and the amazing advances that were occurring every single month with new technology. My wife and I were just in Fiji. We were scuba diving. We love scuba diving. Well, nobody was scuba diving in Fiji until the 1980s. You could stand on a beach, on the island, and you could look out and you could see all this water, and you could maybe snorkel in some of the shallow areas, but nobody knew about the amazing biodiversity and life. Some of the most biodiverse area on the entire planet is under the water, but nobody had seen it. It was created by God thousands of years ago, but nobody had the technology to actually view it. And I was thinking about that when we were diving. Nobody had the technology to dive down to 100 feet and see these amazing coral reefs with hard corals and soft corals. So what we're trying to do is, again, use technology to reveal what's been there for all eternity, but we just have not had the technology to see it. So just like we can now view and visit the coral reefs under the water, we can now view, visit, treat, and cure babies on the inside of the womb because of the advances of modern technology. It was always there. We just couldn't visit it before.
Yeah. So was it just a slow evolution then for you of, seeing this reality and knowing that something needed to be done and there was something lacking in the educational or even spiritual space of someone talking about this? Or was there a specific event that, led you into this specific calling in your life?
It was really that Sunday afternoon when the original plan was to take over the practice and then stop all the abortions. And to this day, since we took over the practice, right now there's not a single abortion clinic on the whole Western Florida panhandle. So you can
Wow.
make a difference by investing. And we have not even a clinic where you can go and get the abortion pill here on the Western Florida panhandle. But it
Wow.
was really, I can't remember what the message was at church that Sunday. But when I went up and I said, boy, this is right across the street from a major church. It's on the same road as Pensacola Christian. There's 1,000-member churches to the left, 1,000-member churches to the right. Why is this a location never not been protested? Why aren't there people out in front? And so we really wanted to bring in awareness, and we were starting to do more procedures to treat and cure the babies on the inside. The church doesn't know this information. And, we happen to have a bold pastor at that time, and he said, absolutely love to have you speak. So we spoke about some of the topics that we're going to speak about today, and the results from pastors and from the people that were members of the church was just stunning. They had
Mm.
never heard that we can treat the babies in the womb as patients. I mean, every state has patients' rights. There are federal laws that protect the rights of all patients. And we wanted to show them that not only do patients have rights, not only do patients not born in the United States have rights, but that patients that were not born in the United States yet also have rights. And it was a messaging that was not available prior to that. So we've now invested fully in this ministry of providing this information. Even we spent a year and a half developing a ProLife curriculum. It's 8 hours of not only workbooks, but video training. We invested over $60,000 during this project just on 3D animations, because
Mm.
I can sit down with my animator and we can have a conversation for 4 or 5 hours about some of the different surgeries we're going to talk about. But he can condense a 4 or 5 hour conversation and in with 3D animation, convert that into 60, maybe 70 seconds of 3D animation. So it's worth the investment when you can take a 4 hour conversation, condense it down to 1 minute. That, and we're just trying to follow the example of Jesus. I mean, we should be doing that every day in every way. But how did Jesus communicate and share lessons with the masses? He
Mm.
told stories. He told
Yeah.
parables. We call them parables, but they're just stories. So we're trying to follow that example to take people into an environment that they have never seen before and to let them know this is not a blob of cells. This is a patient created in the image of God at that moment of conception, and all patients have rights.
Yes, it's very powerful to see those animations and the technology that we have today. It's so clear what we're already told by scripture that God knows us before we're even formed in our mother's womb, but it makes it very clear. And we can see those consistencies start to rear their ugly inconsistencies, to see their rear their ugly heads with, like you said, why is it that we're caring about these patients in some circumstances when the mother wants them, but in other circumstances, we're saying, well, oh, this is not a child because they're not wanted. And we all ultimately know that that is incorrect. I am
Yeah,
just
and some,
curious. Go ahead.
yeah. Well, some people are intimidated by, well, what about follow the science? It's like, science is perfect. Science was created by God. Mathematics, biology, embryology was all created by God. It's just we have had our scientists lose their ever loving minds. They've just gone
Yeah.
crazy, where they don't even know what a boy and a girl. I mean,
Right.
you have a person with 60 trillion cells, and half of those 60 trillion cells all have a nucleus. And if you're a boy, it is XY. And if you're a girl, it is XX. So the truth and the science and the biology is not just an individual's mindset. The truth is actually in the chromosomes and in these cells. You have 30 trillion cells crying out saying, I'm a boy, I'm a girl. And so the science is true. It's the scientists that have just lost their minds.
Yes. So I am curious if you could share with us one of the procedures that, you do in utero that just one of them that would be an example of the incredible things that we can do medically to treat a child inside of the womb?
Sure. Well, there's dozens of different ways now. In fact, there's something brand new just about every month with the advancing technology. But one of my favorite examples to give was performed over at the Cleveland Clinic, where they had a baby that was diagnosed with a cardiac teratoma. What's that? A cardiac teratoma is a tumor that is actually on the heart itself. And they were diagnosing this baby and they were following the baby, but the tumor was growing a lot faster than the baby and the baby's heart.
Hmm.
And if you look at my thumb, the heart on that baby was about the size of the end of my thumb. And at the time they treated it, the tumor was about the size of my thumbnail. And their estimate was that in a week or two, with the growth of that tumor, the baby was going to die because of this growth. So they had two options. Option number one, let's deliver a baby at 27 weeks gestation and then do the open heart surgery. But then you have a tiny pound-and-a-half preemie that just had open heart surgery that had enough challenges and struggles of living on the outside because it's only 27 weeks. But then
Right.
they said we have a second option. The second option was to actually remove the tumor while the baby was still on the inside of the womb. So they counseled the mom and dad were, yeah, let's do that. Sounds like the best option. So the team was assembled. They had not only an obstetrician, they had pediatric cardiologists, pediatric anesthesiologists. They had 36 doctors, nurses, techs, circulators, everybody there to provide health care to the mom and the baby.
Hmm.
Mom had an epidural. So mom is completely comfortable, but mom is wide awake. The OBGYN made an incision in the skin of the mom, went through the fascia, and then got down to the womb, the uterus, and made an incision in the uterus. Once they had access to the baby, they brought out the baby's left hand and they brought out the baby's right hand. I mean, that gave them access to the baby's chest, but the reason they wanted the hands on the outside because they had a pediatric anesthesiologist that was going to start an IV in the baby's hand, not just to give the baby fluids, but to give the baby fentanyl in tiny little doses. Fentanyl is a powerful narcotic, so the baby would be comfortable. But also, they gave the baby a medication called Norcuron. Norcuron is a paralytic, which the heart keeps beating, but the skeletal muscles are paralyzed. So you don't want a patient moving around when you're doing open
Right.
heart surgery. So
Yeah.
once they had and if I'm doing a hysterectomy, does the mom get anesthesia? Sure, she gets her own anesthesiologist. But does the uterus get its own anesthesiologist? No. I mean, that doesn't even make any sense. The uterus is part of the mom. But in the cases where we're actually performing surgery for babies on the inside of the womb, babies get their own anesthesiologist because they are a different person. So once the baby was comfortable, they swapped the teams. The pediatric cardiothoracic team came in. They made an incision in the baby's chest. They opened up the baby's chest. The baby's heart's beating about 140 beats per minute, but they carefully removed the teratoma, this tumor, from the baby's heart. Almost immediately, the baby's heart said, "Thank you very much," and started to function normally because this big tumor is gone. Once they saw that the bleeding was under control, the surgical site was stable, they closed the baby's chest, they stitched the baby's skin back together, they removed the IV, tucked the hands back in, and then they closed the uterus, closed the fascia, closed the skin, and that was at 27 weeks gestation. They didn't deliver that baby for 10 weeks later at 37 weeks gestation. So if we can have an anesthesiologist provide pain control and a paralytic and do open heart surgery for a baby in the womb and then have the baby recover for 2.5 months while still in the womb. Is that a patient? Absolutely. And a patient is a person, no matter how small, and we protect patients' rights in all 50 states and with federal laws. And we're not just doing open heart surgery. We're doing vascular brain surgery for baby. We're doing spina bifida corrective surgery, which is now in its third generation. We're doing laser vascular surgery to, when identical twins are sharing one placenta, sometimes they don't share it equally, and one will be big and one will be small. We can actually go in with a scope. We send all of our patients with this condition to Texas Children's Hospital in Houston. They'll go inside of the womb, and with a laser, they will divide the placenta in two. And they're saying, this is your side, and this is your side. You two play nice. and then they develop normally. They might have been at the 95th percentile and 3rd percentile, but by the time we deliver them, they might be 60-40, 70-30. So we're teaching them how to share in the womb. One of the procedures that's done most frequently is a blood transfusion, because at the moment of conception, that baby is genetically different from mom, genetically different from dad, genetically different from the other 8 billion people on the planet. But there are conditions where moms will have antibodies which can attack the baby's blood. Well, why? Because the baby can actually have a different blood type from the mom. And sometimes, and we can see on ultrasound, the baby's blood count starts to drop. Well, if we're at term, we just deliver the baby. But what do you do if you're at 18 weeks? Well, we actually can do blood transfusions. Take blood that you might have donated at the Red Cross, or maybe one blood. We can take that O negative blood, put it in a needle, guide it through the skin, guide it through the wall of the uterus, and with ultrasound, go right up to the umbilical cord and right into the umbilical vein. We can give that baby a life-saving blood transfusion. So we're even correcting heart arrhythmias, where we are injecting really potent heart medications to correct an abnormal rhythm on the baby's heart. So there's new things, every month that are coming out, and clearly they are patients. It's paid for by Medicaid, it's paid for by private insurance, and groups around the country are specializing and bragging about the amazing things that they can do, that saying, well, we're better than them because look at the amazing stuff that we can do for the babies. So clearly, they're patients, they have rights, and we need to defend them, just because all patients are persons, and they are not only protected because they're a person, but there are laws that protect them.
Yes. Wow. I would have loved to have seen and just felt the feeling in the OR room after that first procedure that you mentioned. I can't imagine what that must have been like to have successfully completed a open heart surgery on a baby inside of the womb. And I just couldn't help myself tearing up while you were saying that, because I have 3 children of my own, and it's just so miraculous. It's hard for me to understand how someone can look at that and not see that as a human being, but also just not know that there is a God.
Well, and there's something amazing called a delayed interval delivery. Most people have never even heard of that before, but a delayed interval delivery occurs with twins. And we had a case at our hospital where mom was pregnant with identical twins. They each had their own placenta, they each had their own sac, but she actually was visiting Pensacola, and she was here for a Toby Mac concert. So at 25 weeks pregnant, she's at the Toby Mac concert up there at the front, and she's just bobbing and dancing and having a good time. But then the concert changed because she broke her bag of water there at the concert. So EMS was called. They brought her up to our hospital. They brought her up to our OBER. And before we could do anything and even evaluate her, she delivered baby A. Baby A was delivered and taken to our intensive care nursery. Baby B was still on the inside, and the bag of water was still intact. So our high-risk docs counseled with the patient. They said, look, baby A is down the hall and doing well in our NICU. Baby B is doing well. We'd like to give you the option. We'd like to give you some steroids, which will protect the baby's brain, the baby's lungs, and the baby's bowel. We'd like to give you some antibiotics, and we'd like to continuously monitor you. Well, so you have baby A created from the exact same egg and sperm that's in the NICU, and baby B that is still in the mother's womb. I mean, they're on different areas of the hospital. There have been cases, there was a case up in Tennessee where baby A was born and baby B was born 6 weeks later. So even when they do great, these kids are 6 weeks. I mean, one was born in June, one was born in August.
Yeah.
They can be in different school years as identical twins. But the amazing thing, in states where this is not that rare to have delayed interval delivery with twins, but think about this. If you happen to be in a state where abortion is legal and performed at any gestational age, you can have identical twins conceived from the same egg and the same sperm, while one baby is in the NICU and has legal rights and protections, just like I would have in a cardiac care unit. Yet it's identical twin who just happens to still be in the uterus, in the womb of the mother, doesn't have those rights. And if the mom were to choose, she could say, well, we really didn't want two. We really only wanted one. And she
Mm.
could legally, in these states, abort the identical twin just because they're in a different geographic location. Our rights don't come based on our geography. Our rights first come from God. I mean, the role and duty of good government in the states and the federal government is to protect those rights, but our rights come from God. So how can one identical twin have rights and the other identical twin does not have its own right to life? But there are just example after example that people can use to say, this is why I'm pro-life. I feel it in my heart and feel it in my gut that killing a baby in the womb is wrong. But we can use the technology, we can use the advances in high-risk obstetrics, even at the Cleveland Clinic. I've seen pictures where the OR, where they took the mom and the baby into so the baby could get open heart surgery. Up above the door that goes into the OR, it says fetal OR. Even though the mom and the baby go into that same OR, the emphasis on the baby, and it says fetal OR, which just tells me so much. But nobody's done a robotic procedure on a baby in the womb, but it's coming. I mean, you give a bunch of docs a new toy, and they're going to want to use the new toy. So things that were just unthought of, just years ago, are now part of regular practice of medicine. And it's really just revealing that using the technology, these are patients, and we can use that information and these parables, these stories, to really save the lives of these babies. And I've got pictures of these babies, not only the videos during the surgeries. I have pictures of these babies 2 years age, 3 years age, 4 years of age. I mean, we are changing the quality of life of these babies for the rest of their lives by treating them as a patient while they're still in their mother's womb.
Yeah. Wow, that's amazing. Thank you so much for sharing all of that. So, one of the things I wanted to do also was have you address from a medical perspective, but also biblical, the most common misconceptions and the lies that I hear about abortion. I know you've already kind of touched on some of these things, but I'll just open it up for you, any particular one that you want to address specifically. But, what I've heard you say a lot is this is a person. And so I hear a lot of arguments about that. When does personhood begin? Is it when they can feel? Is it when they can have cognitive thoughts and feelings and, all these different things? But what does science tell us about when life begins? Because, like you mentioned earlier, a few years ago, we were hearing follow the science when it came to COVID. But seems to be some cognitive dissonance here when it comes to life inside the womb. I also hear my body, my choice a lot, which you've already addressed that this is genetically a different human being from the time of conception. And then I would say the last one I had in the notes here was the dependency argument of, well, this baby depends on their mother. So if you have anything to add to those, I would
Sure.
love to hear your thoughts.
Genetically unique. I mean, we reviewed that from that moment of conception, where one egg and one sperm could come together, and then one cell divides, it doubles its DNA, and it divides into two, and then 4, 8, 16, 32, 64. There's something called cell differentiation, which is an absolute miracle. We don't understand it. I can tell you what happens on day 17, and I can tell you what's going to happen on day 18, but I can't explain to you why, and no scientist can. I mean, how do you, when you have identical cells that have the exact same textbook of DNA, and then they divide into identical copies and they both have the exact same textbook of DNA, how does one cell say, you know what, I'm going to start only reading chapter 3, and the cell that it just divided from says, well, I'm only going to read chapter 7? And then one starts to develop the entire cardiovascular system, and the other one starts to develop the entire skeletal system, and maybe another system, cell starts the entire neurologic system. How do they know? We can tell you what's going to happen, but I can't tell you why it happens. Even at weeks along, there are over 1 billion cells that all have a different function. When it comes to, well, it's dependent. Well, babies are dependent on the mom. You deliver a baby and you just let it lay there, it's going to die. They are very dependent on their mothers. When it comes to consciousness and even feeling pain, I have patients that we do surgery on all the time. They go under general anesthesia. Are they conscious? No. Can they feel pain? They shouldn't. And I have to have a good anesthesiologist. So if I, have an error and somebody gets hurt or even dies, well, they didn't feel anything. They weren't aware of anything going on. Am I still responsible and liable for that? Absolutely. So just because the baby is in a location And moms will tell you, especially as the babies get a little bit further along, you can see and you can feel the different personalities of babies in the womb. I
Mm.
mean, when moms have twins, one will be more active and one will be more quiet. And the personality will be the same on the outside. When you have moms who will say, boy, this baby is just an absolute maniac between 2 a.m. and 5 a.m. I can't wait until I have this baby
Ugh.
and that can stop. It's like if the kid's a wild child from 2 to 5 a.m., on the inside, their personality is not going to change. And, you can see that with Cain and Abel, even in the scripture. You can even see how babies can respond and react. If I'm doing an amniocentesis and we're putting a needle in to do a diagnostic test, and say that needle happens to be still, but the baby moves and the baby butts up, puts its butt up and it hits the needle, babies feel the pain. Babies will consciously move away from that perception of pain and they'll say, I don't know what that was, but I don't want to be in that side of the womb. So we can see babies reacting. Babies go through sleep cycles. We can not only see the babies moving on the inside, we actually have a score called a biophysical profile where we look at baby's breathing movement. We look at fine body movements, like how's the baby doing moving its hands? How's the baby doing with gross body movements? How much fluid is around the baby? So we can assess and we can see if the baby is doing well. We can even look at a baby's heart rate. Just like if you are in the intensive care unit and they have the EKG, which is going beep, 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 we can actually look at the baby's heart rate while the baby is in the womb, and we can say, yeah, that baby is doing well, that baby is happy. Or we can look at the heart rate and go, that's got some concerning features. And when we see those, well, then we have to intervene. So medicine has really looked at the babies as just being a person on the inside. But even when it comes to Luke 1, Elizabeth is carrying John the Baptist, and she comes into the presence of Mary, who's carrying Jesus. And scripture tells us the baby, John the Baptist, leaped in his mother's womb for joy because he was in the presence of Christ. So, yes, they are different personalities. They react, they respond, and moms know the difference between the personality of their first baby, the personality of their second baby, and that personality continues. But even with the technology, where we can do a blood test on the mom, no risk at all to the baby. And it's called a panorama test, where we can get a sample of the baby's blood. And we can look at the baby's blood and we can see lots of fragments of DNA. 95% of those fragments are from the mom, but about 5% of those fragments are from the baby. And we can actually separate. It's kind of like if you had a bowl of sugar with a little bit of salt inside. And if I said, hey, can you do me a favor and remove the salt from that sugar bowl? You'd be like, no way, they all look the same. We can actually use the technology and the science to separate the mom's DNA from the baby's DNA. We can study the baby's DNA. And 7 weeks after conception, I can tell you not if this is going to be a boy or a girl, but if this is a boy or a girl, because it either has XY chromosomes or has XX chromosomes. And that's really the only options. And so we can see this development from the babies on the inside, but we can even treat and cure. When Jesus was asked, what's the greatest commandment? The Pharisees thought they were going to trick up Jesus by saying, what's the greatest commandment? And what did he say? He said two things. Love the Lord your God with all your heart, mind, and soul, and your neighbor as yourself.
Mm.
If your next door neighbor needed a unit of blood and was your same blood type, would you be willing to give your neighbor a unit of your blood to save their life? Sure, you're fulfilling the great commandment. You're saying, I'm going to treat my neighbor as myself, and I'm going to give my neighbor a unit of my blood. Well, we can do the same thing for the babies on the inside, where if you happen to be a blood donor and you have O negative blood, you are fulfilling the great commandment by donating your blood, which we then give to the neighbor, your neighbor, the baby on the inside of the womb. So the animations are just amazing. I was up in Madison, Wisconsin at the medical school, and one of the students was brought to an event by another couple. And Madison, Wisconsin is not a hotbed of conservatism, and it's very, very liberal. And after the event, this student came up. He waited in line for an hour just to ask a question. And he said, listen, he says, I know you believe in God. He says, that was pretty evident from your talk. He says, I don't. He said, I just don't see the whole God thing. But he said, the reason I went to medical school is because I'm a huge advocate for patients' rights, and I want to help all patients. He said, when I walked in, abortion was a woman's choice, and she has that right at any gestational age for any reason. He says, I just had no idea that we were treating the babies in the womb, diagnosing them, treating, and even curing the babies in the womb. He says, yeah, they're patients. And he says, abortion is wrong. He said, I still don't believe in God. I said, well, we'll work on that. But he said, when it comes to abortion, he says, you just solved the debate and the argument for me. He says that they're a patient, they're a person, and they do have rights, and it is not correct, to just, look at them as waste or just a byproduct. They are individual persons. So science is pure. Scientists are sometimes messed up, but we want to we stopped using the actual surgeries, which I thought were amazing, but we had people passing out. Some people just don't like watching surgery and blood. So
Yeah,
that's always shifted to the animations.
right.
And they're just effective tools. Again, they're telling stories, they're parables, and there's just no denying. We can see the baby's heart beating, 18 days after conception, where things are so well developed that you already have a heart that is beating, circulating blood at just 18 days after conception, which we can see on ultrasound. So they are patients, they're genetically unique, and all patients have rights. And who knows what the next amazing feat we'll be doing to treat these babies in the womb. We're actually using stem cells now to correct spina bifida. We have a defect on the baby's spine. UC Davis out in California has a trial called the CURE trial, CURE. I mean, they're optimistic that they have a cure for spina bifida, where they can
Wow.
take donated stem cells, which were harvested from placentas after a mom has delivered, and stem cells are called totipotential cells. So if you're in med school, you get a big word, you break it down. Totipotential. It just means this cell has total potential to become whatever it wants. It's a stem cell. So these stem cells, have the potential to become anything. They just need a little bit of guidance and direction. They're kind of like a 5-year-old. What's a 5-year-old going to be when they grow up? I don't know. They need guidance, direction, education, and training. Maybe they'll be a pastor. Maybe they'll be a doctor. Maybe they'll be a nurse. Maybe they'll be a teacher. They need guidance and direction. So when the doctors out at UC Davis actually take a tiny little patch that's been seeded with these stem cells and surgically apply it to the defect in these babies' spines. The stem cells kind of wake up and they go, oh my gosh, I have my guidance and direction. I know what I'm supposed to be when I grow up. They actually start to develop normal spinal tissue. And these babies, which were not moving their legs, not moving their feet, a couple weeks afterwards, start to move their legs, start to move their feet. When we treat these babies in the womb before they're born, we've improved the quality of life. They can go upstairs faster. They can go downstairs faster. They have better control of their bladders, better control of their bowels. They're new persons created in the image of God at that moment of conception. They are dependent on their moms on the inside. Mom's an amazing life support system, but they're also dependent on the moms after they deliver.
Yes. Yeah, it becomes very arbitrary when we try to decide where does personhood begin. And I think that's something that, I get some pushback from liberals or progressive Christians saying that, well, you should just focus on the gospel. Why do you talk about these things so much, or these controversial things, or in church? We just need to focus on scripture. And, I have a lot of thoughts on that. For the sake of time, I would say that I think this can really be an agent to lead people there, because just like that doctor that came up and spoke to you, I believe that they will start to see these inconsistencies. Because something that just came to mind as you were talking is that, we're trying to determine personhood. If you're trying to determine that from an atheistic point of view, which really very often, if you follow it to a logical conclusion, it's very materialistic, meaning that you don't even necessarily believe in anything than the physical. And so then how are we even to say when personhood begins? And, you could follow with, well, if it's not feeling pain, if it's, like you said, not consciousness or certain cognitive functions, well, then is it okay to kill disabled people, mentally disabled people, because they don't have these same cognitive functions or as us, or they still depend on someone sometimes for their entire life to live?
Yeah, and even let's look at scripture. I mean, you'll have some churches who say, we don't get involved in politics here. We just share the truth and happiness and the gospel. Well, let's look at the gospel. Let's look at scripture. You know, let's look at examples. Did any people, any characters in the Bible get involved in politics? I mean, look at Moses. Moses went up to Pharaoh and says, "Let my people go." He got
Mm.
involved in politics. Daniel, Shadrach, Meshach, Abednego, Samson. I mean, Paul. Was Paul involved in politics? Absolutely. He was involved in politics, and he would get beat up and stoned when he got involved in politics. I mean, when you look at John the Baptist, he went up to Herod and he says, "Hey, you're sleeping with your brother's wife. That is wrong." He got involved in politics. He was
Yeah.
beheaded for that. But there's so much. Did Jesus get involved in politics? Yes, he got involved in politics. And it's the politicians and the priests at that time, the leaders at the time, which actually put him on the cross. Not just
Mm.
not because he did wrong, but because he gave his life. He wasn't killed. He gave his life. And he was dead for 3 days and miraculously conquered death and rose again. So we say, well, this is all politics. Well, this is a spiritual battle. And if you're engaged in a spiritual battle, yes, it's great having obstetricians like me who are engaged in this battle. It's great having politicians who are engaged in this battle. I mean, when I took over the practice, you could legally perform an abortion at 24 weeks gestation here in Florida. Legislatively, we brought it down to 15 weeks, and then we brought it down to heartbeat. Now we're going after the abortion pill. So politicians can be a benefit, but you don't want a politician from his podium leading a spiritual battle. This should be our
Yeah.
pastors and our priests that should be at their pulpits leading the spiritual battle. Lifeway and CareNet did a study, and it showed between 18 and 24% of all the men and women in a congregation have personally been involved with an abortion. Nationally, that number is about 25% of the general population. So this is not a problem outside of the church.
Right.
And my wife was very involved in post-abortive counseling. These women and these men are hurting. They need healing. Healing comes from true forgiveness, and true forgiveness only comes from the gospel, which comes through the blood of Jesus Christ. So yes, the gospel needs to be our priority number one. Share that healing message of love, of God offering us that opportunity for spending eternity with him. But we also have to realize that we have people that are hurting. I mean, almost 24% of the people in our congregations, abortion has been part of that past. And
Mm.
so, yes, we have to be preaching from the pulpit. Abortion is wrong, and this is why it's wrong. It's an
Yes.
attack on the image of God in the womb. But we
Yes.
also have to say, but even if this is part of your past, and just be humble. I mean, I'm a sinner. I mean, I deserve hell, no doubt about it. But it's the gospel message of God loving us that much that he sent his son, lived a perfect life, gave his life, conquered death 3 days later, which we're getting ready to celebrate on Resurrection Sunday. I mean,
Mm.
that is the message of the gospel. But we also have to realize that people need forgiveness, they need healing, and that healing is available. But we have a duty to defend the image of God there in the womb. And people say, well, why, what is abortion at anyway? Well, if you've ever seen somebody burn the American flag, why do they burn the American flag? Well, the American flag, with its red, white, and blue and stars and stripes, is the image which represents the United States of America. If you hate the United States, you want to destroy the image which represents the United States of America. Well, in Genesis 1:26, after God had created the billions of galaxies, the billions of stars and planets in each galaxy, and then all the mountains, all the rivers, all the streams, all the birds, the mammals, and the fish, then God said, let us make man in our image. So when you look at the abortion industry with over 1 million abortions each year, why is it there? The abortion industry hates God. So they can't destroy God. So they're trying to destroy the image of God in the womb. Not because I say that's the image of God in the womb. God himself said, let us make man in our image. And the only event which is that dramatic, which says something new just happened, is that moment of conception. Because
Mm.
as an OB, I can determine when I'm going to induce you. I can determine the day and time when I'm going to do a C-section. I don't have the power to create somebody and to determine that you are now a person. The only big event that occurs is when you have a unique person, different from mom, different from dad, different from the 8 billion people on the planet. That moment of conception is when clearly we are created in the image of God.
Yeah. And so you also, a part of your ministry is taking some of those abortion utensils or, sorry, tools, whatever they're called, to take, do you do videos with those and you
Sure.
show kind of how they work? Can you talk towards that a little bit? Why you do
Well,
that?
Sure, we want to give people evidence and truth, and I'm not afraid of sharing the truth. But we
Mm,
also have to realize there's a lot of people have been through an abortion, but we want to provide the teaching. The practice that when we took it over had an abortion machine, it had abortion instruments, and we use these instruments to show how a surgical abortion is done because a lot of people don't know. So
mhm,
with high quality, we actually shipped all this equipment up to a studio in Washington, D.C. And for our curriculum, we recorded how a first trimester abortion is done, a second trimester, even a partial birth abortion. Even me as an obstetrician demonstrating these procedures, especially the partial birth abortion. We actually give the people who subscribe to the curriculum, we give them two options when it comes to the partial birth abortion, where a baby's legs and feet are delivered, then the abdomen, then the chest, then the right arm, and then the left arm, and then the baby is killed while the head is still on the inside of the vagina. But we
mm.
give them options. They can either watch a very generic plastic doll, which is showing how the procedure is done with my hands and the instruments. Or if they want to get a more realistic view, we had a realistic silicone baby, appropriate in size, that was appropriate in weight and joints and mobility. And we actually did that with that as well. It was tough to perform. I was weeping while I was doing this. I'm like, how can somebody do something like this? How can somebody know that this baby is alive and deliver this life and abort it? And so we develop this curriculum so people will know. But the minority of abortions are now performed surgically. And the majority, at least 64% of all the abortions in the United States, are performed with the abortion pill. There's some countries in Europe where it's over 80, almost 90% of all the abortions up to 10 weeks gestation are performed with a pill. And we can talk about that as well.
Yes, so about the procedures and you showing those, you know, I think there's a lot of pushback on that and people don't want to see it. And it is extremely disturbing and barbaric to witness. But part of exposing the truth is protecting people ultimately. And I'm sure that for women that have had them, it's extremely hard to face that. But it could also prevent people from making that decision for knowing the truth because so many women are lied to. And you know, Emmett Till's mother was the mother of a black boy in 1950s, I believe,
Yeah.
that was beaten to death. And one of the things she said was that they're going to take the casket off of this and have an open casket so that people will see what was done to her son. And that's something Seth Gruber says in his ministry, the White Rose Resistance. You know, he says we're going to take the casket off of abortion
Yeah, we
to
need to.
show what it really is.
And there's the venue where all those things are appropriate. And we try to share the truth with understanding the sensitivities of people. We try to, and it depends on the venue. If we're doing a presentation at, let's say, a pregnancy resource center, in that venue, this is mostly a pro-life group. And so we won't show the pictures that are available where you see a baby's hand on a quarter or a foot on a dime.
Yeah.
That's not the right venue. In fact, we have gone to venues where we knew they were going to show some of those dramatic pictures and videos. And with permission, we've set up a camera, a GoPro up on the front of the stage because I wanted to see what's the reaction of the audience. How do they respond? And what we found was over 84% of the audience, when we went back and looked at the films, when these real graphic videos were being shown, that the vast majority of the people either had their heads down, their eyes closed, some even had their fingers in their ears.
Mhm.
And you are not teaching these people. I mean, I'm an instructor, been an instructor with the University of Florida in Florida State. If my students in front of me have their eyes closed and their fingers in their ears, I'm not teaching them anything. It's
Yeah.
the truth and it's the reality. So we took an approach with the curriculum where we wanted to convey all the exact same information without, showing things that the audience that we're targeting might not, you know, continue to view. Now, when
Yeah.
somebody is walking into an abortion clinic and they've got a baby on the inside and you want to, I've got 30 seconds to try to change their heart and mind. Sure, that might be an appropriate,
Yeah.
timing to say, I'm going to throw the Hail Mary pass. This is my last shot, and
Right.
I'm going to try to show them what that is. But that's the truth and that reality of abortion when it comes to war crimes, when it comes to, even after World War II, the concentration camps. One of the first things they did was not to secure and bring in more troops and stabilize and bring in the food. They brought in the film crews. They brought
Mm.
in the film crews, and thousands of hours of video were recorded just to document this brutality. And even still, now we're so many years from the 1940s. There are people who still deny that the Holocaust happened. So you're always going to have those deniers. You need to have documentation. Sometimes, like when it comes to somebody who's in legislation, you need to show some of the truth that's there.
Yeah.
And so, yes, there's a role to play when we're speaking in churches with kids. Is that the place to show that kind of, really, it's nightmarish kind of material?
Yeah.
It is 100% the truth, but you have to, look at your audience as well and look at the venue as far as educating and teaching. That's why when it
Mm.
comes to the surgery, we shifted to animations. And when it comes to the demonstrations of abortion, with the first trimester abortion, we demonstrate it with the machine, but to demonstrate the power of the machine, we actually take the suction curette, which is what goes inside of the womb, and we actually place it in a 1-gallon steel paint thinner can. And then, we place it in the lid of the can, and then we turn on the abortion machine, and that steel can will just
Mm.
crumble. I can stand on that can, but it will just crumble and crush from the vacuum. So when people say, well, it's just a blob of tissue, well, when you're walking through the grocery store and you see the ground beef, it doesn't look like a cow, but it's gone through a process of being ground. So the products of conception after a first trimester abortion just look like tissue because they've experienced that much force. Just like hamburger doesn't look like a cow, the material that is delivered after an abortion doesn't look like a baby, but the ultrasound shows us that baby had a heart. We see fingers, we see toes, we see fingerprints on these babies. They're a person, even early on, not just a blob of tissue. I mean,
Yeah.
we have done blood transfusions to these babies at 18 weeks. I mean, a month and a half before this baby could even survive in the best NICU. So ultrasound is an amazing tool. MRI is a safe and amazing tool. We have a curriculum. Our third curriculum that'll be coming out is going to be geared towards kids between the ages of 8 and 12. It
Mm.
might be too early to discuss the abortion issue, but we want them to visualize that when they see a woman with an enlarged belly, that it's not just mama with a big belly filled with tissue, but that there's a patient and there's a personality there on the inside. So we can use ultrasound, show babies jumping up on the inside of the womb. We can use MR and see babies standing up on the inside of the womb, standing up on their feet on the inside. We've got a great MRI of that to really show that personality. And so what we're seeing is that a lot of kids, by the time they enter their teenage years and they're maybe 13, even when they're homeschooled, they're going to church every Sunday morning, Sunday night. They're involved in their youth group. They're going to church on Wednesday. But then somehow when they enter into high school, they come home and they say, boy, abortion's a woman's right. It's like, how did my kid get this? Because the social media and is just so pervasive and invasive that this information and the messaging gets out. So we really need to get our kids on board and teach them from the very beginning. They're such visual learners. I mean, you look at the popularity of TikTok. We've really grown and raised our kids to learn from a 60, maybe 120-second video. So we're
Yeah.
trying to match that, where we can
Yeah.
show all these amazing surgeries. We can show clips of personality of babies on the inside. We can show twins struggling on the inside, see babies standing up on the inside of the womb. And there's no denying it doesn't look like a blob of tissue at all. I mean, you
Yeah.
could take a 10-year-old. It's like, what do you see? Well, that's a baby. Well, then how can all these politicians not be as bright as you and discerning as you to realize that that's a baby on the inside? So let's
Yeah.
use the tools that we've been given, that we have been developed, and let's defend God's preborn with the technology. But we have to remember this is a spiritual battle. So we have to engage with prayer, we have to engage with scripture, and we have to encourage our pastors, priests, our rabbis to engage as well.
Yes. So let's shift gears a little bit and let's talk about, obviously, from your profession, you will know this very well, that this has been circulating this whole narrative that, well, pro life laws are putting women's lives in danger, and essentially saying that this is outlawing miscarriage care. So, and specifically, I'd love if you could talk about, the way that it's coded for insurance. A miscarriage is called a spontaneous abortion, at least the last that I had read about that. So, are women's lives really being put in danger from pro-life laws?
The pro-life laws have not put women's lives in danger at all. And I'm just going to read from you. Florida has a heartbeat law. We went from 24 weeks to 15 weeks to 6 weeks. We have a heartbeat law. And before a physician performs a procedure, if in their reasonable medical judgment, the termination of pregnancy is necessary to save the pregnant woman's life or avert a serious risk of a substantial or irreversible physical impairment of a major bodily function of a pregnant woman, then an abortion or termination of pregnancy can be performed. Then it goes on to say that if it's an ectopic pregnancy, a tubal pregnancy, then yes, perform the procedure. If it's a miscarriage without heartbeats, then you can perform the procedure to resolve that condition. Even when it comes to procedures like molar pregnancies, which have a positive pregnancy test, but this is not a pregnancy which is going to result in a baby. There is no limitation and there is no delay. When we were going through the heartbeat law here in Pensacola, in Florida, there were actually physicians who were going on ads and say, if a heartbeat law is passed, I'm not going to be able to perform a D&C for a patient at a miscarriage. Or if she has an ectopic pregnancy, my hands are tied. I can't treat that life-threatening ectopic pregnancy. Governor Ron DeSantis fired right back. He sent a letter to every licensed physician in the state of Florida saying, knock it off. These are lies. You know they're lies. They're being deceptive, and stop it right now. And
Mm.
so there are no limits. If the mom's health and life is in jeopardy, then yes, the procedure can be performed. And all you got to do is read the laws. And I guarantee you, if these physicians went through college and they went through medical school and residencies, they are literate. All they have to do is read the actual law to dispel. Now, what is putting patients in danger is the abortion pill, because the abortion pill is now performed. 64% of all abortions are performed with the abortion pill, and the abortion pill will kill a baby in the womb up to 10 weeks gestation. Yet we are having women dying from taking the abortion pill.
Mm.
One of the more famous cases was a woman in Georgia named Amber Nicole Thurman. Amber was pregnant, and she realized that Georgia has a heartbeat law where you're pregnant, you can't get an abortion. They're defending and protecting the patients on the inside of the womb. There are lots of resources that are available to help moms, but you just can't kill your baby. So she actually made an appointment in North Carolina. She had an ultrasound, said she was pregnant with twins and about 9 weeks along. She ran into traffic while driving from Georgia to North Carolina. She ran into a lot of traffic and she arrived late, and they were not able to perform a surgical abortion for her. So they offered her the abortion pill. The abortion pill can only be taken up to 10 weeks. And so she was right at that edge. They gave her the abortion pill, and then there's a series of pills to take the next day as well. And she drove home from North Carolina to Georgia. Did the abortion clinic in North Carolina even call her to say, hey, how you doing? No. Amber got home to Georgia. She started to have bleeding, but then she thought she was having the abortion at home, but then she started to get a fever. And then 3 days later, she says, I'm sick. And she went to a emergency room of a local hospital. The ultrasound was performed there at the local hospital. And yes, she was pregnant with twins, but neither baby had a heartbeat. Both babies were already dead, but the babies were dead and the tissue was still there on the inside. Amber was getting sick from an infection from dead necrotic tissue. They consulted the OBGYN who was on call. The standard of care would have been, number one, go and do a history and physical and see your patient, and then start antibiotics. And if the babies are both dead, do a D&C, empty out this infection that's on the inside of the uterus. Well, he didn't even see her for 20 hours after she was admitted to the hospital. He realized she was really sick. She was becoming septic. They were having trouble keeping her blood pressure up, and they took her to the operating room thinking, well, let's do the D&C. She was really fading fast. So they didn't just do a D&C. They ended up doing a hysterectomy. When they were in the inside, doing the hysterectomy would have kept her from having any babies in the future. They realized the infection had spread to the bowel. They tried to treat that. Amber Nicole Thurman died right there. She didn't die because of a heartbeat law because neither baby had a heartbeat. You see politicians saying that she died because of Georgia's heartbeat law. How can a heartbeat law even remotely come into play when neither baby had a heartbeat? She should have had that D&C. Amber Nicole Thurman died because she was given poor care and the standard of care was not upheld. It wasn't because of Georgia's heartbeat laws, but we're seeing more and more women coming in with side effects and being injured and some dying from taking the abortion pill. And even when the women are given the abortion pill, they're told that if you go to the ER, don't tell them that you took the abortion pill. So you're denying the physician in the ER very vital information of what's been transpiring, what's been going on. I mean, would you say don't tell somebody you're allergic to penicillin? No. We need all the information possible. So it's really tough to see how many women have complications from taking the abortion pill because they're specifically told, don't tell the physician that you took the abortion pill. I'm not going to bring any judgment. No physician is going to bring judgment. If somebody did an illegal drug, I don't care about whether you did an illegal drug. I just want the information so I can fix you and I can cure you. So it's tough to tell, but we're seeing more and more reports, and especially now that something as basic as an ultrasound is not being performed, you can now not only get the abortion pill available mail order, you can get it mail order from China. You can get it mail order from India, and we're seeing more and more complications. Only about 30 to 35% of women really have a good idea of how far along they are when they are pregnant. Maybe they're a little bit, further along than they thought. It could be 3, 4 weeks further along than they thought. So we're having women who have taken the abortion pill. Were they up to 10 weeks? No, sometimes they were 14 weeks. The abortion pill might be strong enough to take the life of the baby, but the medicine the next day might not be strong enough to deliver that baby. But
Mm.
the other thing is that the number one pregnancy-related cause of death nationwide in the first trimester of pregnancy is a ruptured ectopic or tubal pregnancy. Just having 2 lines on a pregnancy test only says there's a pregnancy. Doesn't tell you where the pregnancy is. And statistically, nationwide, 1% of all pregnancies will be ectopic or tubal, the fallopian tube being most common. The tubal pregnancy is a cause of damage and death of women, but the abortion pill will not treat an ectopic pregnancy. So when a woman receives the abortion pills, she's told you can expect to have bleeding, cramping, and pain. And they walk away with those instructions of what to expect. What are the symptoms of a rupturing tubal pregnancy? Bleeding, cramping, and pain. The symptoms are the exact same. So when a girl has a positive pregnancy test and she is scared, she doesn't, a lot of times they don't tell their friends, they don't tell their parents, they are going through this alone. And then there have been cases where parents have found their daughters dead. They didn't even know they were pregnant. They didn't know they had taken the abortion pill. And then the postmortem exam shows that, yes, your daughter was pregnant. Yes, it looks like she took the abortion pill, but the pregnancy was inside of her tube. It ruptured and she bled to death. Your daughter is dead because of an ectopic pregnancy. When she had
Mm.
had that pain, she probably would have gone to the emergency room because something was definitely wrong. But she's been told you can expect to have bleeding, cramping, and pain. It's just bad medicine. Half
Yeah.
the patients are going to die. I mean, the babies in the womb are my patients. We've talked about that. So when you have half of the patients dying, but you have women being injured as well, I mean, that's just not good healthcare. That is bad medicine. And the abortion industry is kind of looking over and not addressing the risks and the complications to not only these babies dying, but to the moms as well. I mean, it's just not something that should be available mail order from other countries. We have people dying. We had over 120,000 people die of drug overdoses last year. And we have an antidote for that, which is Narcan. Well, we have a lot of people that are being hurt and dying from the abortion pill. It's bad for moms and it's bad for babies, and we need to stand up for good health care.
Yeah. Yeah. And a lot of times, or I would say majority of the time, but you can correct me if I'm wrong on this, they can even be given out by not a medical doctor. I mean, just people at the clinic, correct? I mean, they are not verifying, or especially if they're mail ordering the abortion pills. I know the director of the pregnancy center I work with here. We do an Embrace Grace program. I don't know if you've heard of that
I sure do.
program, but
Know it well.
yeah, so she ordered some pills for herself and just put in false information. Nothing was verified. Never talked to a doctor. It barely had instructions on the packages. And when she looked up the address from where it was sent, it was like a vacant lot somewhere in the middle of the United States. So, can you speak a little bit more just about that factor?
Sure. I mean, the abortion pill is available. I mean, we, have a lot of associations with Tim Tebow's industry that is working on, really defeating and bringing awareness to sex trafficking. And in most of the sex trafficking, we live right here on Interstate 10. So that is the main thoroughfare that goes east and west of the United States. So from here all the way over to I-95, which is going north and south, is a huge area of sex trafficking. So when
Yeah.
they are trafficking these young girls, pregnancy is not good for business. So once a month, they make them take a pregnancy test. And if the pregnancy test turns positive, they will force these young ladies to take the abortion pill. And this is not regulated. This is, not supervised. They have not done an ultrasound on these girls. A lot of these girls really want to keep this baby, regardless of the circumstances of the conception. They want
Yeah.
these babies. And they're not only putting the lives of these babies in jeopardy, they're putting the lives of the moms in jeopardy, but they're also scarring. These women have already been going through so much. They are scarred. They have been hurt. And then to put on top of that, forcing them to have an abortion on top of that. I mean, it's just sad. But the abortion pill, you can go on there, just Google abortion pill. And, anybody says, oh, it's not that available. Go ahead and Google it. It is. If you live in a pro-life state, it's like, well, we've got a heartbeat law. Yeah, well, the abortion pill is coming up by the UPS and by the U.S. Postal Service right in. We don't have dogs that can sniff out for the abortion pill like we do with drugs. So if your daughter has a cell phone, she has access to the abortion pill, I promise you. There are even organizations which will pay for the abortion pill for somebody who doesn't have access to funds, that they will pay for that. And they think they are doing a service. This is an evil demonic effect where you have people who are under the influence of Satan himself, and they are taking the lives and attacking the image of God in the womb. And
Yeah.
we have a duty to stand up for these young ladies, share them the healing message of the gospel, get them out of the situation that they are in. That's why we have pregnancy resource centers. We
Yeah.
have over 3,000 pregnancy resource centers that don't charge these girls anything. They provide free ultrasounds, free healthcare screenings, counseling. They'll even have job, training. A lot of them even have housing situations for them. They have men's
Mhm.
ministries because every pregnancy, except for one that I can think of in the last 2,000 years, involved a guy. And these
Right.
guys, and a lot of these guys want them to have the baby, but they're being shut out. So
Yeah.
a lot of these guys grew up in a family where there was no dad. So when they show up and the mom is getting a free ultrasound and health screening and counseling, it's so great to have these guys, these dads who show up where there are mentors at these pregnancy centers that can
Yeah.
help the guy saying, listen, congratulations, you just procreated. You have a baby that is now going to be due on such and such a date. Let's walk you through what are the steps to be a dad. And if they don't have a skill, there are job training, there's education, there's GEDs. There are so many resources where they are trying to be the hands and feet of Jesus at these pregnancy centers, where they're not there to condemn, they're not there to judge, they're here to meet their needs, both physically, emotionally, financially, but most importantly, spiritually. Share the gospel because the gospel is where healing begins.
Yeah. Yeah. So, also something you mentioned earlier, but I want you to touch on a little bit more because I've heard this a lot online, is that women think the abortion pill is one pill. So, can you discuss what the actual mechanism
Sure.
and the procedure of the abortion pills are like?
Sure. Well, at least 64% of all of the abortions in the United States are now performed with the abortion pill. And it's not just one pill. First, how does the pill work? Well, the first pill, the RU46, the mifepristone, is a pill that blocks a very important hormone called progesterone. You
Mhm.
break down a big word into little pieces. What is progesterone? Progesterone is the progestational steroid hormone, progesterone. When a woman becomes pregnant and the positive pregnancy test occurs, all of a sudden the body says, we're pregnant. Congratulations. We need to keep the progesterone going, and we need more progesterone, because it is the signal from progesterone that says we're not going to have a menstrual cycle. We're going to increase blood flow to the uterus. We're going to increase appetite. And our new full-time job is supporting this pregnancy, this baby that's on the inside of the womb. So progesterone is very vital. It first is produced by the corpus luteum, which is from the area on the ovary where the egg came from. But then once the pregnancy implants in the lining of the uterus, and it's developed by the placenta, and it just shoots up. So the abortion pill will block the signal of progesterone on the woman's body. So the woman's body is celebrating, woohoo, we're pregnant. We need more progesterone. Let's produce progesterone. But then she's either forced or she makes a bad decision and she takes the abortion pill. Then all of a sudden, the receptors for the progesterone are like, I could have sworn we were pregnant. I guess we're not pregnant. But that will only withdraw support for the pregnancy. And we've got a great animation. It's 3.5 minutes long, but it's amazing. It shows this process. But now it's withdrawing support, and it will kill that baby usually within the first 72 hours. But that just kills the baby. It doesn't deliver the placenta. It doesn't deliver this baby with fingers and toes and a heart and a head that's been functioning on the inside. So on the second day, you are given a medicine called Cytotec, misoprostol. This is a prostaglandin that causes contractions. And we use the same medication, Cytotec, in regular obstetrics. If I'm inducing a patient who's 41 weeks along and she has an 8-pound baby, we will give her 25 micrograms of Cytotec, because that's enough to get the uterus to contract, to start the labor process to deliver the baby. When it comes to the abortion pill regimen, they're not given 25 micrograms of Cytotec. They're given 800 micrograms of Cytotec. So you don't just take the pill and then it kind of just stops the pregnancy, everything dissolves and goes away, and you're back to school or work in 2 days. This is a violent, there is a lot of blood. There is passage of tissue. We've all seen the pictures of babies when a mom is pregnant and it's her first ultrasound, and we're all oogling and going gaga over seeing this baby. Look at the fingers, look at the toes. That all has to pass. And it can take days for this process to happen. And usually these poor girls are alone. They might be at home. They might be in their dorm. They might be in a hotel, but they're going through this process alone. A lot of pain, a lot of bleeding, a lot of bad memories, which they will have forever because of this trauma. So it's
Mm.
not just take the pill and everything just quietly goes away. It's a series of pills, and it's a miserable experience. But we're seeing more and more complications of these young ladies coming into the ER.
Yeah. Yeah, it's hard to justify your position that you would say that you're pro women, pro women's choice, that you care about women or a feminist, and then also support this, even if you're pro abortion, also support this not being monitored by a doctor. Yeah, it's all really, really difficult to understand how people get there. But I say this a lot on my show, is that they call evil good and good evil, and their minds are
Absolutely.
darkened. Last question, and then we'll
Well,
oh, go ahead.
let's talk about a little bit of hope. I mean, I'd love to, end on something positive and giving hope.
Yeah.
Yes, the abortion pill is responsible for about 640,000 abortions in the United States each year since Roe versus Wade was reversed. And everybody celebrated, like, wow, we won. No, we didn't win. The numbers of abortions are back up over 1 million again. And the number one advance in the numbers has really been the abortion pill.
Mm.
People make mistakes. People are scared, they panic, they make decisions that they didn't want to. People make mistakes with narcotics. I mean, we see that when it comes to fentanyl, where people, for whatever reason, they take a narcotic, they overdose on a narcotic, and they stop breathing. Well, does everybody who makes a bad decision die when they overdose on a narcotic? No, because we have an antidote. An antidote is called Narcan. You can actually order it without a prescription through Amazon. It comes in a shop, and it also even comes in a nasal spray that somebody can use. And it's like Sleeping Beauty, where the person who overdosed on a narcotic is not breathing. They are clinically dead. You might need to start breathing for them, even doing CPR, but we have the antidote which can reverse the effect of the narcotic. By giving them a shot or giving some of the nasal spray, we are saving thousands and thousands of lives. We have Narcan, which is, in churches now. We have Narcan, which is in our schools. We have Narcan, which is on board our airplanes, and the cops carry Narcan. Canine cops carry Narcan to give to their dogs, because if the dogs are sniffing through some luggage that has fentanyl in it, just by sniffing the fentanyl, dogs can go down from a narcotic overdose. So we have Narcan available for dogs as well. Well, we all make mistakes. And a lot of women realize they were panicking. They didn't know where to turn. They didn't have any support. They thought that the world was just turned upside down. They take the abortion pill, and it's amazing how many of them will have immediate regrets,
Mm.
and they'll look for help. And they think sometimes that there's nothing I can do. Well, there is something we can do. We have the antidote for taking the abortion pill, and that is called progesterone. If
Mm.
the abortion pill was bringing progesterone levels down, we give progesterone, and we can bring the progesterone levels up. We have a network of over 500 doctors, nurse practitioners, nurse midwives that we have trained on the reversal protocol, where we can give them progesterone. To date, just back in December, we have documented at least 5,000 successful reversals. I've attempted
Wow.
reversal 26 times personally, and I've been successful 19 out of those 26 times. And I not only have the privilege of delivering these babies, but I have pictures of these babies. I have pictures of these babies in first and second grade. And I have one where it was a couple that mom found out she was pregnant. She panicked. She drove all the way to Jacksonville, Florida, and she took the abortion pill. She was driving back home, and she saw a billboard that said heartbeat at 18 days. She kept driving and saw another billboard that said, your mom chose life, you should too. That was enough to change her mind. She pulled over, she Googled abortion pill antidote, which led her to our website, which is abortionpillreversal.com. She called the toll-free number, spoke with a nurse. Nurse called me. We called in the antidote. We called in progesterone. And progesterone is something that we use in healthy, normal pregnancy all the time. If a mom is pregnant with triplets or quadruplets and she's having preterm labor, to keep the progestation going, we will put them routinely on progesterone. Say mom had a pregnancy, then had a miscarriage, had another pregnancy, had a miscarriage. Her body probably is not producing enough progesterone, so we give her progesterone to prevent a third miscarriage. In future fertilization, the body wasn't expecting embryos to get delivered to her uterus, so we have to send progesterone to keep the pregnancy going. So we use progesterone all the time. We can actually call in a prescription. We pay for all the prescriptions that we call in, my wife and I, and we can actually give them progesterone to bring the progesterone levels up. We're successful about 60 to 65% of the time. And here's the key. It's either a red light or a green light. There's no in between. You either save the baby or you didn't save the baby. You don't save the baby, but it's missing fingers or toes. We don't see that at all, and the science doesn't bear that out. So, but that's the same thing about what happens with us as believers. 100% of us were heading to an eternal separation from God. I mean, does God love everybody? Yeah. But we were heading to eternal separation from God, not being in heaven and spending eternity in hell. Then we have a change of heart. We have a change in mind. We change, and we, then look to Christ as our Savior. And does he buy us back with $100 worth of progesterone? No. He buys us back with his own blood, something very, very precious. So salvation is available for everybody. And the Bible word would be called redeemed. What does redeemed mean? It means to buy back. So when mom makes a bad decision, we can spend $109 and we can buy back the life of that baby with the progesterone. All of us have made mistakes. A lot of us have been involved in an abortion, but we can be bought back not with $109 worth of progesterone. Our eternity can be bought back through the blood of Christ. And that's the message of the gospel. Yes, that is the primary reason why we have churches, why we have pastors, why we are sharing this amazing message of good news of the gospel. And when I think about the gospel, I mean, what books in the Bible do I think about? You can see the gospel from Genesis to Revelation throughout the whole Bible. But I think about the first four books in the New Testament: Matthew, Mark, Luke, and John. The good news, the gospel. God loved us so much, he sent his son, he died, He was dead in the grave for 3 days, and he conquered death and rose again. And if we accept him as our Savior, then we can spend eternity with him. Well, that's the message of the gospel in Matthew, Mark, Luke, and John. But what's the fifth book in the New Testament? It's Acts, the Acts of the Apostles. And that's the second function of the church, where we need to put our faith into action, where
Mm,
it wasn't the hangout of the apostles or the chill out of the apostles. It was putting their faith into action. So, yes,
yeah,
we have the first four books. That's the gospel, the good news. But then we have Acts. So, if we are a church, we are a pastor. Pastors have a huge responsibility because of the position that they are blessed to be in, as far as sharing the gospel message, sharing the healing message of forgiveness, but also putting their faith into action to defend the preborn in the womb. And that's why we are having this webcast today, because we want to give information, we want to provide tools, but we also have to share the message of the gospel, which is available for even abortionists. That message of healing and forgiveness. Paul, we hear about Paul the apostle and all the writings. He wrote more of the New Testament than anybody else. But before he had an amazing experience on the road to Damascus with Jesus, he was literally going around and killing Christians. That was what he did. But then he had an amazing change of mind, change in heart, change in soul, and he became a follower of Christ and, was a bold leader. We just need more boldness, and we need to encourage our pastors. If you've been at a church and you've been there for 10 years and you've never heard a message about abortion or about forgiveness or how we can get involved, go encourage your pastor and say, hey, I've been here for 10 years. I've never heard a message on abortion. Encourage them. And then go with the group and say, hey, all of our families, we want you to preach this and we are here to encourage you. And if
yeah,
he says, oh, we don't discuss the issue of abortion here, you got to think, is this where I want to be raising my kids? Is this
mm,
where I want to be tithing? Is this where I want to get my spiritual growth and where I want to be fed spiritually every Sunday? And really think, is this the church where God wants me? Or is God leading you to another area of ministry? Because, we hear, judge not, lest you be judged from Matthew 7 all the time. But then we read a little bit further along. Then what does it say? It says to look for the wolves in sheep's clothing. You can only see the wolves in sheep's clothing by truly assessing them and judging them. And the wolves in sheep's clothing are our enemies. And sometimes they're behind a pulpit. Sometimes they're behind a podium. Sometimes they've got great music and they've got smoke and fog going on. But you have to wonder, is this my pastor or is this a wolf in sheep's clothing? So we need to look at the bright side, look at the gospel, the forgiveness that's available to everybody. It doesn't matter how many abortions you've been involved in. Forgiveness and healing is available for everybody. And yes, even when we make a bad decision and somebody takes the abortion pill and there's a 98% chance that that baby will die, we have a window of about 72 hours where we can provide them with progesterone and reverse the effect of the abortion pill. And I've got babies that are now entering second and third grade that would have been dead 8 years ago. But mom had a change of heart, change of mind, and we were able to use a little bit of medicine, a little bit of science, and a lot of prayer and save the lives of these babies.
yeah. Amen. Amen. All right. Well, I know we're out of time. So if you will just let people know what you have coming up. I know you said you're working on another curriculum and how people can find you, follow your ministry, and support you all.
Sure. Well, it's real easy to follow us. We have our whole schedule listed on our website, which is prolifedoc.org. You can put in questions. You can contact me via email, and you can even order the curriculum. The curriculum comes with a workbook and about 8 hours of video of topics that we have covered. One of my favorite chapters is chapter 8. Chapter 8 specifically goes through all the scriptures of everything from what it means to be created in the image of God to even when you had John the Baptist leaping in his mother's womb for joy in Luke 1. So it's very comprehensive. I think it's the most comprehensive pro-life apologetics curriculum that's available, but you can get that all at prolifedoc.org. And thank you for the opportunity to be on with you.
Yes, absolutely. Well, thank you, Dr. Bill. And I'm sure that we'll have the opportunity to have you on again and further discussion. I feel like I could talk to you all day. So, but thank you so much. And I hope you
You're
have
welcome.
an awesome rest of your day. And we will be praying for you and your ministry.
I appreciate it, and God bless you as well, and have a wonderful Resurrection Sunday coming up.
Yes, thank you.
You're welcome.